today we're going to learn about dentistry. And what is dentistry? It's studying, fixing, and taking care of our teeth. If there's something wrong with your teeth, you have to go to a special doctor, right? You have to go to a dentist. So what are teeth?
The teeth are helping, like they can help with like whenever you're trying to bite food.
Our teeth are very, very important for us to be able to break down food. And so grab your Play-Doh and vampire fangs. So what I want you to do is take your teeth like this and pretend your teeth were going to take a bite out of this. So go arr, like that. And now you can see what kind of marks your teeth would leave. So these teeth are a lot more like an adult human mouth. I'll go ahead and show you what an impression looks like from this. That's what it actually looks like if we were to bite down with all of our different teeth. And do you see how these marks are deeper than these marks? And so that's because they're going to do different things, just like our vampire fangs. So if you notice, with our vampire fangs, we have one really deep hole, right, on either side, and some flat ones. What this showed you is that when we bite down, our teeth do different things, right? So with our vampire fangs, we have two different types of teeth here, right? These ones up front and then these sharp ones, right? So if you notice, we have still some sharp fang-like teeth on here, right? But they're not quite the same as our vampire fangs, right? Our vampire fangs are much more fang-like. And so these extra sharp ones are called canines. And there are other flat ones up here are called incisors. Does anyone have an idea what these back ones are called?
Molars.
Molars, they are. They're called molars. We have incisors up front. Remember your front teeth that are flat or thin on the top? You have your canine that's going to be sharp and pointy on the top. And you only have one of those on either side, left and right, on bottom and top. So you should only have 4 canines. And then you'll have incisors. And you have 4 incisors on the bottom, 4 on the top. And so next to the incisors are the canines. And then we have the premolars and the molars. Oh, our canines right next to our incisors help us tear. So canines and incisors do very similar work for our food. They help us cut and tear food. And the molars help us crush and grind food. So now that we've learned that we have 3 different types of teeth, we're going to talk a little bit about what's going on. This is a tooth, and then this part that we're looking at is if we could see the inside of a tooth. The pinkish part is the gums in your mouth, right? If I go back to my tooth model, it's all of this. And so the tooth part that's above the gum is called the crown, and the tooth part that's inside the gum is called the root. So the crown all the way down to the root has this outer layer called the enamel. And the enamel protects the dentin. And the dentin is the more sensitive part of our teeth. Something happens and we get a hole in our enamel and then the dentin is exposed. That's how we get a cavity. And that can be really, really bad because cavities make a hole, an entrance for bacteria and plaque and things like that to get inside to your dentin. Now we're going to spend some time learning how to prevent cavities. Our apple is going to pretend to be a tooth for a little bit. So the skin of our apple is going to be like our enamel, right? And so if we have an apple covered in skin in the fridge, is it gonna turn brown on the inside? No, right? It's all protected. It's nice and safe. But if we had cut up apples, like apple slices in the fridge, are they gonna turn brown? Yeah, right? And so that's kind of like tooth decay. It's not exactly the same, but we're gonna do an experiment here. So our skin is like the enamel, the apple skin is like the enamel, and the inside part of the apple is like the dentin. So I'm gonna take my pencil and I'm gonna stab the apple because we're gonna make like if we had a cavity so that the dentin is exposed, and we're gonna leave it overnight until tomorrow and see what happens to our apple tooth. 2 eggs right here. And our eggs are also going to be pretend teeth right now. So the egg shell is a lot like the enamel on our teeth, and the yolk on the inside is a lot like the dentin. I'm going to pour over 1 egg a bunch of Coca-Cola. And over the other egg, I'm going to pour mouthwash. Mouthwash, and we use fluoride. We can help repair our enamel and fix those holes sometimes. And so what we're doing right now is letting our soda egg and our mouthwash egg sit for like 24 hours to see if those cavities will form. Because the best things to do to prevent cavities, to take care of our teeth, are 1, to brush twice a day. You should brush in the morning and brush at night. You should also floss once a day. And you should try to go to the dentist every 6 months for a cleaning. So when you start brushing your teeth, you want to start on the top and do little circles all the way around, just like this. Obviously, I'm moving the teeth, but you can move the toothbrush. And then once you're done with the top, you're gonna go down to the bottom. Also start with little circles. And so we're gonna do all the little circles on the front, all the little circles on the front, on the bottom, just like that. And then we're gonna go back to the top. And remember, we're gonna brush out on our front teeth. Brush out, brush out, brush out. And then we're gonna go on the inside of our mouth and big circles. And you should tickle the roof of your mouth. You wanna tickle the roof of your mouth because that makes sure that you're also cleaning your gums, remember? We wanna get all the way up there on both sides of our teeth to be able to get them nice and clean. And then whatever you do at the top, you should do the bottom. So we're gonna brush out again on our front teeth, on our incisors. And then we'll go back to our molars with some big circles. So after we're done doing the inside parts, now we can do the biting, the chewing parts of our teeth, right? All the parts of our teeth that touch food. So where we bite with our incisors and our canines, where we chew with our molars, right? Back and forth, all the top teeth, all the way into the back, and the bottom teeth, back and forth, back and forth. And then the last thing we should do is open up and get our tongue. They're here. Do you remember that we made a cavity inside our apple? We're gonna see what's happened to our apple that sat with a cavity all night long. Now, the apple's been cut for a bit, so this part turned brown. But do you see how dark brown it is inside the cavity? All of that is rotten apple. All of that is apple that got gross and infected by bacteria overnight. And this is what can happen to our dentin if we don't take care of cavities. This next experiment that I'm going to show you. So remember that overnight, we let one egg sit in mouthwash and one egg sit in Coca-Cola. And so our eggs are just like the apple. There are fake teeth. This experiment is if we don't take care of our teeth, that's like if we leave our teeth sitting in Coca-Cola all the time, versus if we do take care of our teeth, when we then have something that has more acid in it, something like a soda, or in this case, this is vinegar. When you have something that has more acid in it, our teeth are better protected. So when I put the mouthwash egg into the vinegar, we don't see much happen because it's protected. It hasn't been, we're taking good care of it. It wasn't sitting in soda all the time. But if we don't take care of our teeth and we keep having things that have acid in it, then we're not gonna do too well. What observations do you have? What guesses do you have about the other one?
It's like a brownish.
Oh, let me pull it out. Exactly like you all said, it's all brown, right? The soda has caused cavities in our egg all night. And so when we put it into the vinegar, we're gonna see it bubble a bunch because it has all these cavities and the acid is able to rush in. And so, do you see all the bubbles on it now? All of those bubbles are little cavities where the vinegar is able to make them bigger and bigger. So, do you notice that like there's a difference in color? That's because I've been brushing this with my hands trying to get it out. So if I take a toothbrush to it, look, we can get all of the dyed stuff right off. I do have a guest speaker coming to talk to us today, and Miss Saiema is awesome. She's a student at the University of Southern California, and she is studying how to become a dentist. So she's going to talk to us about different things that dentists do.
So a dentist is a doctor. They are a doctor of dental surgery. So a dentist, they are skilled to practice in the prevention, diagnosis, and treatment of diseases, injuries, and malformation of the teeth, jaw, and the gum. So typically there are 7 different types of dentists. So the first type of dentist is a general dentist, and then we have pediatric dentist, and then we have orthodontist. Those are the doctors that help us get braces. Dentists. They're the most common type, and these are the people that you're visiting in your dental or yearly dental checks. The basics is cleaning and dental evaluation. Become a dentist, you have to attend high school and graduate. And once you get into a university, you can major in any subject you want. And then before you apply, you have to take this dental admission test. Also have to shadow a dentist for at least 100 hours. You have to apply to dental school, which is typically 4 years long. If you're interested in specializing, you have to go to this thing called residency for a couple more years.
So how do our teeth end up yellow?
Sometimes our teeth is yellow because we're not brushing them enough and it's just like food coloring. Other times it's yellow because our enamel has dissolved.
Well, so much for coming.